carbohydrate or keto diets are reduced or restricted in carbohydrates and typically place more emphasis on higher fat foods. Low carbohydrate diets are less restrictive than ketogenic diets. They allow for some carbohydrate foods such as fruits and whole grains and a larger variety of vegetables depending on what the individual is aiming to achieve with the diet. Ketogenic diets are very low in carbohydrates and typically contain less than 30 to 50 grams of carbohydrate per day. These diets emphasize fats, proteins, and low carbohydrate foods. The goal is often to achieve nutritional or metabolic ketosis, which basically means that the body is using fat as its main fuel source rather than glucose or carbohydrate. Now, some people with diabetes do choose low carbohydrate or ketogenic diets as a strategy to improve their blood glucose management and possibly reduce the amount of medication that they require. Some people find that they are better able to manage their weight following these diets as well. But research demonstrates that many people find it challenging to follow these diets over the long term. And in fact, at this point, we really don't have a lot of data showing that the benefits of low carbohydrate or ketogenic diets are long lasting. There is no one type of diet that is recommended for either type 1 or type 2 diabetes. It's important to recognize that there are many different dietary approaches that can help people living with diabetes achieve their health goals. People with either type 1 or type 2 diabetes can safely and successfully choose to eat a low carbohydrate diet. But it is recommended that they talk to their healthcare provider or someone like a registered dietitian that can provide information, guidance, and support to help identify any potential risks there are with following a low carbohydrate or ketogenic diet and how to manage them. It's also important to make sure that we continue to focus on the quality of our food choices rather than just focusing on the amount of carbohydrate a person is consuming through their diet or fat or protein. So there are several things to be cautious of regarding low carbohydrate or ketogenic diets if you live with diabetes. First, if you're taking insulin or medications that put you at risk of having a low blood sugar, these medications may need to be adjusted. To reduce your risk of having a low blood sugar, it's important to speak with your doctor or diabetes educator if you're planning on making any significant changes to your eating habits and carbohydrate intake. The second caution is if you are taking a medication called an SGLT2 inhibitor, as this medication can put you at greater risk of developing diabetic ketoacidosis if you choose to follow a low carbohydrate diet. Again, it's important to consult with your doctor about this. And the third caution is that the more restricted a person aims to be with their carbohydrate intake, the greater risk there is for not getting all the vitamins and minerals their body requires to be healthy. In addition, because a low carbohydrate diet is often higher in fat, it's important to ensure that the diet is not too high in saturated fat, which can potentially increase the risk of heart disease. I do strongly recommend seeking the advice of a registered dietitian to ensure that a low carbohydrate or ketogenic diet is not increasing the risk of other health conditions.